Welcome to HSA Your Way. My name is Katrina. Let's take a look at how you can spend, save, and invest in your healthcare with a health savings account. But first, let's see how well you know your HSA. Which of the following is not true about a health savings account? Your HSA funds roll over from year to year. You can invest your HSA funds. HSA funds go with you if you leave your employer, or HSA funds are use it or lose it. If you had said HSA funds are use it or lose it, you are correct. Many people still commonly think of HSAs like FSAs, that their funds are use it or lose it. Fortunately, we know that HSA funds roll over from year to year. And as you accumulate funds, you can invest them and take them with you if you change employers. How do you connect health and wealth? We all have different goals that we're working toward, and the Williams family is no different. Holly, a smart spender and married mother of 4, is trying to find ways to save money by spending wisely on her family's medical needs. Oliver, Holly's brother, has a specific healthcare expense in the future that he's saving toward. We call him a savvy saver. And lastly, their parents, James and Patricia, have their mind set on retirement. And as informed investors, they are looking for ways to increase their tax advantage retirement investments. Let's see how both spending wisely and taking advantage of the unique triple tax benefits of their HSAs can help each member of the Williams family reach their goals. Let's start with Holly. Holly is our smart spender. As we mentioned, Holly is always looking for ways to be more efficient and resourceful with her family spending. In fact, she and her husband initially chose an HSA qualified plan 2 years ago simply because of the lower healthcare premiums each pay period. Over the past 2 years, she's been happy to see that by contributing pre-tax dollars to her HSA, their healthcare dollars stretch further. Actually, over 30% further on eligible expenses than if she had paid for them after tax. As she budgets for this year, she has 2 major healthcare costs in mind: paying to treat her own insulin-dependent diabetes and keeping her 4 energetic, competitive kids healthy and safe. Holly decides to call her health plan provider to ask her questions about lab work, blood tests, and examinations associated with her diabetes. She also asked about her in-network options because she's learned over the years that she'll save money by choosing those in-network providers for her plan rather than going to out-of-network providers. Holly saved money by switching to generic drugs and buying a less expensive blood glucose monitor and test strips. Holly also found out that the typical blood work done at her doctor's office cost anywhere from $55 to $70. She found out that she could buy her own hemoglobin A1C test at her pharmacy for less than half of that. She actually did the test at home and simply called her doctor with the results. She also learned to watch for coupons and rebates to pay for her family's prescriptions, saving them about $1,000 over the year. With 4 children active in sports, she's also thinking ahead about those inevitable injuries. As she searches online to learn more about emergency treatment costs, she's learned that the urgent care is generally less expensive than a trip to the emergency room. Let's see if you're aware of how costly a medical emergency can be. Visits to the emergency room typically cost how much more than going to an urgent care facility? Is it 3, 7, 2, or 5 times more? If you selected 5, you are correct. The ER can cost 5 times more than the urgent care facility. It's true. When Leo, Holly's son, was injured at a football game, Holly took him to urgent care rather than going to the emergency room. She avoided paying 5 times more just by knowing where to go. And because Holly frequently checks her balance of her HSA dollars using the Health Equity mobile app, she knows that they are covered for this incident. You too can save money by avoiding emergency room visits when possible and choosing an in network urgent care facility, or if the situation allows, making an appointment for care with one of your in network physicians. It's important to plan ahead, to call your health plan, and know which facilities to go to when emergency medical situations happen so you don't have to pay high costs for emergency room visits. Holly's older brother Oliver keeps a close eye on his budget and is focused on saving for long term expenses. Oliver and his husband Lucas have an HSA and HSA qualified health plan through his employer. By contributing pre tax to his HSA and letting their funds grow tax free, they are able to plan for their future healthcare costs, specifically for Lucas's knee surgery. Although Lucas is relatively healthy now, he tore his ACL a few years ago playing on a community soccer team. At the time, he was told that knee surgery was optional, and he never really prioritized it because of the cost. He only occasionally feels the pain of injury, but knows he'll never feel safe playing soccer again until he has that surgery. Because he's married to a savvy HSA saver, Lucas and Oliver decide to start planning for the cost of the ACL surgery by maximizing their family HSA contributions. This year, that means setting aside $7,200 for their future. Instead of paying for qualified medical expenses like doctor's visits and prescriptions with pre-tax HSA funds, they actually decide to pay out of pocket instead. Every month, they log into the Health Equity member portal and see their tax-free earning balance grow year over year, month over month. Knowing they can reimburse themselves in the future for these expenses if they choose to, they scan their receipts using the Health Equity mobile app. With an HSA, there is no time limit to reimburse yourself for qualified medical expenses that you have paid for out of pocket, which means you can accumulate the reimbursable amount until you reach a determined savings goal while building tax-free earnings. With time to plan, Lucas also shops for the best orthopedic surgeon at the most reasonable price. He is shocked to see that prices range several $1,000s and saves around $5,000 just by comparing options and asking questions. When they reach their savings goal and Lucas has his knee surgery, he's able to use funds from their HSA to pay for physical therapy and prescription medication, making the recovery much easier to handle physically and financially. Just to remind you the amounts of how much you can contribute to this amazing account, let's review the contribution limits for 2021. If you have single coverage, you can contribute up to $3,600. If you have family coverage, like Lucas and Oliver, you can contribute up to $7,200. And lastly, if you are age 55 in the calendar year or older, you have the ability to make a $1,000 catch-up contribution. You can see here that the tax savings are incredible just for contributing to your health savings account. Also, keep in mind that some companies contribute to their employees' HSA accounts. It's worth asking to see if your company is one of them, and keep in mind that those contributions do count towards these contribution limits for the year. Holly's dad, James, and his wife, Patricia, are thinking a lot about their dream retirement life: to sell their house and buy an RV and travel around the US visiting national parks and visiting their grandkids too. Patricia and James are our informed investors. Both have planned well and invested in their 401ks, and they now have a combined total of about $250,000 invested in index funds. They've experienced a lot of stock market fluctuations and have always believed in the long-term rewards of keeping their money invested. Knowing they could withdraw funds tax-free, yes, the funds they also invested are pre-tax, after the age of 65 to pay for eligible medical needs, they've been investing their HSA funds for the last 10 years as part of their retirement strategy. They logged into the member portal and chose to enroll in automated investing so that when they reached the required balance, it would be automatically invested for them. With the family history of diabetes, both Holly and her dad, James's diabetes costs average about $9,600 yearly. And while they knew they'd have enough to cover this in retirement, they've recently learned that medical costs in retirement would be higher than they had originally planned. Rounded to the nearest thousand, how much money do you think the average American couple will need to cover out of pocket healthcare costs in retirement if they were to retire today? Is it 100,000, 300,000, 200,000, or 400,000? Current estimates say that a retired couple will need at least 300,000 for healthcare in retirement. James and Patricia are ready for their golden years. James has committed to investing at least $3,000 per year for the last 10 years or so in his HSA account. With an average of about a 6% rate of return, he was able to save an estimated $39,000 to help pay for their retirement medical needs. James and Patricia plan to take advantage of preventive health care covered 100% by their HSA qualified plan, specifically their annual wellness physicals and cancer screenings, blood pressure screenings, and cholesterol screenings. This way, they will know early if new healthcare expenses will arise. Also, please note that your HSA funds can also be used to pay for Medicare Part B, Part D, and Medicare Advantage premiums as long as you are age 65 or older. James and Patricia can also treat their HSA funds like a traditional individual retirement account after the age of 65. That means they can take money out for anything they like, but they'll pay taxes on it when they do, just like with a traditional IRA. Flying the whole family out to meet them in Yellowstone Park is one idea that they have. They could pay the regular income tax rate on the HSA fund money and use it to pay for the big family vacation. Now that you've met a smart spender, a savvy saver, and informed investors, it's time for you to decide, how will you connect your health and wealth this year? Whatever you choose to contribute, however you choose to save, we make it easy to use your HSA funds with HSA debit cards. Use your login and manage everything with our simple mobile app. Want to submit a claim? Just snap a photo and you're on your way. And you can call us day or night. Our member services team is available 24/7, 365 days a year to take your calls and respond to any questions that you have about your health savings account.